Hello, everyone, and welcome to today's webinar, Strengthening Health System Resilience and Security, a curated collection of surge capacity tools. Before we begin, we'd like to review some housekeeping items. First, please note that this webinar is being recorded. We will follow up with the webinar recording and presentation after the event. All attendees will be muted throughout today's session. There are two recommended ways to connect to audio for today's webinar, computer audio or through the Call Me feature in WebEx. You can switch your preferred audio method at any time by selecting the down arrow next to your mute button and then select Switch Audio. We do hope to hear from you throughout the webinar. We invite you to submit all questions and comments into the chat feature. You can open the chat by clicking the chat bubble icon that's located on the lower right-hand side of your screen. Please send your questions and comments to everyone so that all panelists and attendees can see them. That is all for our tech notes for today. I will now pass it over to James White to introduce today's content.
Great, thank you, Kayla, and good morning, everyone. My name is James White. I am the Senior Technical Advisor for Health System Resilience for the LHSS project and lead APP's global health security work in the international division. I'm very, very happy to be informing you about this site today. We have some great speakers from Georgetown and hopefully one of our field colleagues joining soon to go through the healthsecuritynet.org website. This webinar is hosted by the Local Health System Sustainability Project, or LHSS, which is USAID's flagship initiative in integrated health system strengthening. Our goal through LHSS is to help countries achieve sustainable, self-financed health systems that offer quality healthcare for all. And you can learn more about LHSS at lhssproject.org. So next slide, please. So again, just a quick agenda. After my remarks, we'll be handing over to Dr. Rebecca Katz from Georgetown's Global Health Science and Security Center. We'll be hearing from Haley Robertson on the surge capacity database and a tour through the library of materials. And then we'll hear from our colleague Nora Razakova, who's just joined us to speak about operationalizing this site in Tajikistan. Next slide, please. Again, here's our speakers, Dr. Rebecca Katz from the Center for Global Health Science and Security at Georgetown, Haley Robertson, data research analyst in the center, and Dr. Gunoy Razakova. Thank you. Next slide, please. So a little bit of quick context before I hand it over to our colleagues at Georgetown. We know that we live in a complex world. There are more expensive and impactful global shocks occurring and stressors throughout our health systems that are increasing in frequency. We know that pandemic preparedness and response, often referred to as PPR, requires a focus on both continuing the provision of essential health services in times of emergency, but also having the ability to surge services when required. The COVID-19 pandemic really demonstrated the need for these rapid access to these tools. Certainly, we had existing websites, we have the World Health Organization and other leading sites, but there needed to be a repository where folks could access these tools quickly. So USAID invested in both locating and compiling some of these best practice examples from across the globe and wanting to inform governments and stakeholders about where to find these tools in times of emergency. So LHSS worked to compile several resources and worked with Georgetown to make sure they were made available broadly on the healthsecuritynet.org site, which you'll be hearing more about in a moment. Next slide, please. So before moving forward, just a couple quick reminders about some key terminology and important concepts that we think about in terms of health security. So in terms of this concept of resilience and health system resilience, this is the ability per USAID's definition of people, households, communities, and countries to mitigate, adapt to, and recover from various shocks and stressors to the health system or indeed to society. We try to do this in a manner that reduces chronic vulnerabilities, but also facilitates inclusive growth. And you see here a diagram describing absorbative, adaptive, and transformative forms of resilience. And we look at these as different ways to respond to different intensity level and cost of various shocks and stressors. So again, resilience of the health system being our key goal. Next slide, please. So then we come to this idea of surge, and that's what you'll be hearing about today and the additions that have been made to the healthsecuritynet.org site. Surge capacity, briefly, again, is the ability to manage sudden or unexpected or prolonged increases in demand for healthcare, both in an emergency and or just in a need for increased volume of service. And an easy way to think about it in some people's minds is the 4 S's. So we need the staff, we need the stuff, we need the structures and the systems and best practices available to us to appropriately put forward a surge response, but also for it to be successful. So with that in mind, an increasingly complex world, the need for resilience and the need for tools that can guide us in our surge responses, I hand over to Dr. Rebecca Katz, a leading expert on health security globally. Over to you, Dr. Katz. Thank you.
Thank you, James. Thank you so much. We are delighted to be with all of you today and very appreciative that you are all interested and also able to join us at this webinar. We're excited to show you Health Security Net, and in particular, this new material that's been added on specifically on surge capacity. Next slide. But if you'll permit me, I'd like to just take a quick moment to say a few words about our center. So I have the privilege of directing the Center for Global Health Science and Security at Georgetown University. We are a multidisciplinary research center, and we've been working for a really long time on trying to build the evidence base for global health security policy. This slide gives you an idea of some of the areas of work that we're engaged in, from financing health security to law and governance, to the science behind One Health, to building evidence libraries like the one that we're about to discuss today. Next slide. And as part of our work, we host a range of tools, visualization dashboards, decision support tools, and data libraries that we've developed and curated by our team at Georgetown. And we invite you to take a look and explore. The link is on this slide. It's ghsidea.org. And to highlight that, Health Security Net is just one of about a dozen tools that we have on the site at the moment. Now, the point of today's webinar, though, is to talk about this one of our evidence libraries, Health Security Net. So if you'll go to the next slide, please. In the summer of 2020, we were asked to build out a library of pandemic-related materials. To be honest, it was the push that we needed to pull together a lot of material that we had been working on and storing in lots of different places over the years. But the purpose of this effort was first to, we believe, offer the first curated compilation of global health security writings and assessments prior to the COVID pandemic. The second purpose was to establish that evidence base to enable pattern identification that may help us better understand preparedness and response dynamics. We were trying to provide a foundation for future research. We can develop new and improved policies by using many of the resources that are living currently in the database. And finally, we really wanted to understand how the literature translate into effective response. So if you go to the next slide. So we created this living library. It is a publicly accessible, searchable database. It currently has more than 2,300 curated pandemic-related documents that have been published over a 25-plus year time period. It includes pre-existing warnings, evaluations, oversight efforts, strategies, technical guidance, and other documents that would help us identify the ways in which decision makers have been previously informed about pandemic threats and risk, but also a one-stop shop where if you are looking for a document related to a given topic, this should be an easy entry point to try to do that. And we are continuing to add to it. So I'm going to hand over to my colleague, Haley Robertson, to talk you through this new catalog of surge capacity documents. And as I do, I also invite you to play along if you're online. Well, you're all online since you're on the webinar, but if you have the space on your screen, it'd be great if you can also open up the site and play with it as Haley talks you through. So Haley, over to you.
Great. Thank you so much, Rebecca. Next slide, please. As Rebecca said, HSN is an evolving library. And while many of the documents in the site are historical, we've also captured resources that are timely for response and resilience. As part of that effort, our most recent surge capacity update is intended to centralize resources for decision makers, handling the pressures placed on health systems by COVID-19, or to guide recovery and future investments in health systems. When we first began this update, we started by searching our existing library for documents with surge-related keywords in the description or in the title, and ultimately found 33 documents that were already captured about these topics in our library. As part of that update, we also expanded our search and made the surge capacity documents a routine part of our collection and capture, finding over 159 additional documents that we've added and tagged for a total of 192 documents that now can inform surge capacity and resilience, in addition to the over 2,300 total resources on the site. Each one of these has been hand-coded with over 30 metadata, such as the date published, the publishing organization, access information, as well as tags. In the HSN site, tags are designed to support filtering and searching for documents that share a specific health security topic. So in this case, we've added 4 new surge capacity tags to make it easy for users to target these resources and quickly identify them. The ones that we've pulled forward here are those surge capacity tags, and they include medical surge capacity, health system surge capacity, surge resilience and recovery, and then surge supply management. Medical surge capacity includes those resources that are describing things like the rapid training of new health personnel, emergency task sharing, standard operating procedures for identifying medical needs, and examples of documents that could fit within this tag-based category are Excel-based models for estimating the hospital staff needed to respond to COVID-19, or guidance from WHO on the delivery of COVID-19 immunizations in refugees and migrant populations. For health system surge capacity, we found resources that were related to preparedness and rapid response surge planning, such as the institutional roles and responsibilities at various levels and in diverse sectors, across topics such as procurement and supply chain issues, diagnostics and surveillance, community mobilization, and whole community surge approaches. Examples that you could expect from this category are reports from Africa CDC on cross-country learning for community health system integration and financing in emergency response. For surge resilience and recovery, we found resources describing how to develop those resiliency methods, the recovery strategies. You may notice that this category has quite a bit fewer documents than the others. We expect that this is a category that we'll see grow as we continue to learn from the COVID-19 pandemic and as we develop updated methods for resilience and recovery. Currently, the types of documents in there are workforce strategies to prevent burnout, such as from HHS, USHHS, or other state health agencies, as well as the UN Office for Disaster and Risk Reduction. Finally, for surge supply management, we include resources that describe particular emergency response financing methods, multi-sectoral approaches such as involving resource sharing, or financing the continuity of services. We additionally include procurement and management of surge essential supplies and materials within this category. So you could imagine vaccine storage and handling toolkits, guidance on essential supplies forecasting, and documents of that sort. Next slide, please. The next few slides present the specific surge capacity methodology that we used for this update. As referenced in the previous slide, our team compiled a list of keywords and phrases to help guide us in our search for surge capacity records. The keywords and phrases shown here were chosen based on a review of the surge capacity literature, collaboration with our research partners, and subject matter expert determination. They represent topic areas and issues relevant to each of the 4 surge capacity tags. Some of these keywords were already in our initial research effort, for which there is documentation available on the HSN site. For example, we represent crisis standards of care as a standalone tag in the first phase of the original research effort, which we also recognize as relevant to medical surge capacity. So we already had many records on this keyword represented within the HSN library. Next slide, please. We then used combinations of keywords and phrases to search the gray and academic literature for surge capacity records meeting the following criteria. The documents needed to be or include actionable information and tangible guidance for decision support, such as toolkits, planning checklists, but this could also include reports and journal papers with useful evidence for decision makers or comprehensive recommendations. The guidance in the documents we determined must also be generalizable across settings for inclusion, and we excluded any documents that were so specific that they would only be useful for a particular facility or apply within a single jurisdiction. These criteria are specific to the surge documents. They are a more extensive set of inclusion and exclusion criteria, which can be found on the documentation page of the HSN site or in the accompanying manuscript. It's also worth noting that while it is not specifically included as criteria, the bulk of documents included are primarily English language. If you are interested in the inclusion of records in other languages and have resources that we should review for the site, please reach out and let us know. Again, this is a living library. It is constantly evolving, and we are hoping to continually expand the resources available to apply to a more diverse settings. Next slide, please. As for the entities represented in the data, we included resources from 80+ organizations in the surge expansion. The WHO, US HHS, US CDC, ECDC, and Africa CDC were among the publishers most heavily represented in the surge capacity editions. These organizations operate at a high level of governance, publishing credible guidance which is applicable to many settings globally. Given that these are many of the first institutions that are called upon for assistance with response, it makes sense that they would be among the top publishing organizations for surge capacity. For instance, the resources from WHO included in this update are primarily about COVID-19 and provide detailed guidance that many countries, regardless of the context, could implement. Next slide, please. We also broke down the types of resources included in the site. Our focus on actionable information resulted in nearly half of all items captured in this update being technical guidance or tools. This is the first time that tools, such as models, calculators, were able to be included on the HSN site. We also captured reports, journal papers, plans, tabletop exercises, and situation reports. You'll notice there were fewer simulations and situation reports included. These were less likely to meet our inclusion criteria due to the specificity of the documents. Among the ones that had topical relevance to surge capacity, they were often not very generalizable. Those that were included provided high-level overviews of surge-related issues or had recommendations that could help strengthen overarching structures. Next slide, please. Now we're going to dig into the fun part a little bit more to see how these things come together on the site and how a user could expect to access these resources. There are 2 primary ways to get to the surge capacity documents from the landing page, and this is the part where I think it would be helpful to play along. A new user's eye, you immediately will be drawn to the yellow banner at the top of the page announcing the recent update, which you can click to go to a pre-filtered page including all 192 surge capacity resources. You could also click the permanent surge capacity button on the top of the search bar to be taken to the same pre-filtered page. Next slide, please. both of those options will take you to this page, the pre-filtered option, to automatically have all of the surge capacity tags selected, displaying 192 results. You can remove any of these filters to fit individual needs, to fit your team's needs, as well as to select additional filter criteria such as the year or the event if there is a specific type of resource in mind, and as well as the capacity to add keywords to the search. In this way, the HSN site fits the needs of many different audiences, from somebody wanting to do exploratory research to learn more about surge capacity, or an individual with specific and precise needs in mind, such as a decision maker or health system leadership. Users can download all of the results from this page at once if you prefer to look at it in a spreadsheet format or scroll through individual resources on the site. Next slide, please. By clicking on individual resulting resources, you can quickly identify key information about that document or tool. A pop-up will appear with a detailed description, information on the subject matter, publishing organization, related event, and funders are all immediately available. You'll also notice a little bookmark flag in the top right. You could toggle that, and we'll come back to that feature in just a little bit. Next slide, please. Users can also preview and download resources directly within the site, provided that open access to the resource is allowed. For certain tools which do not display best as PDFs, users may redirect to the link where the resource was originally published, or you can just visit the URL with the original site where it is currently hosted. Next slide, please. Another useful feature within the HSN site is the ability to discover new resources. After clicking on an interesting resource, you may scroll down and find a list of suggested items, which is based on the search and selections made, which encourage users to learn more about the topic at hand and exposes them to guidance and tools that may not otherwise have been known about. As we said, there are over 2,300 resources in the site, tons to dig into and discover. So the option to discover related resources, there are likely many interesting toolkits that otherwise may not come across in a Google search because they are all curated within the HSN library. Next slide, please. While looking at search results and browsing new resources, you may come across items that you would like to come back to or that you would like to otherwise save. By checking the flag in the top right of each record, you can bookmark the item and save it for later. The Bookmarks tab is unique to your browser and will hold the resources even if you navigate away from the page, refresh, or close out of the window. So in this way, you can come back to the HSN site again and again to review bookmarked items. And personally, one of my favorite features, you can use the Download Bookmarks button in the top right corner of the page to download a spreadsheet with all of the information about bookmarked resources. This makes doing literature review and sharing items with broader teams and collaborating with other colleagues very easy and makes it easy to tailor the HSN library to the specific needs of your organization and team and save time spent doing that compilation work with this tool. There's plenty to dig into, and we encourage you to explore the site in depth on your own time, as well as after this webinar, and reach out to us with any questions. For now, I'll turn it back to Rebecca to close us out.
Thanks, Haley. So if you can go to the next slide, please. Thank you. So we're showing you all of this because we hope you're going to use it. The library is evolving, and we are always anxious for user feedback. We're also expanding it. So this month, we're adding new records on monkeypox and polio, as well as constantly searching for new records to include. But from our experience, it really isn't until users get into a tool, break it, let us know, and then we can fix it. So if you have any records or if you know of a tool you think would be important for us to add, or you've gone in and you're starting to use it, but you're having some trouble or difficulty finding something or have a suggestion, please reach out. So the main email address is healthsecuritynet@georgetown.edu. You can go to the next slide, please. I'd like to take a moment to just acknowledge the funders and the partners in this effort. So Schmidt Futures funded the original research effort, and as well as the design and build for Health Security Net. But the addition of the surge capacity tools and frameworks has been a partnership, as James described, between our team at Georgetown and the local health system sustainability project supported by USAID. Last slide, please, or next slide. Again, the general mailbox for the site is healthsecuritynet@georgetown.edu. And Haley and I are presenting today on behalf of our team, including my co-PI, Dr. Ellie Graydon, as well as the entire research and coding team that's been involved in this effort. That includes Caleb Bridgewater, Siobhan Robinson-Marshall, Kiara Wheats, Emily Woodrow, Tess Stevens, and Ryan Zimmerman. So we are just really, again, so grateful for your interest and time today, and I'll turn it back to James.
Thank you so much. So as you can see, everyone, I think, there's a lot to explore on the HSM site, and more importantly, on the broader suite of the ghsidea.org suite of tools that Georgetown and others have put together. Before we go to any questions and answer, I would like to hand over now to my colleague, Dr. Gunora Razakova from our LHSS Tajikistan project to talk about how we're already starting to operationalize both HSN as a site, but also the tools. Over to you. Thank you.
Thank you, James. Yes, in Tajikistan, currently, APT is implementing several projects, and HSN is now used by at least 2 of our projects, and we promote HSN by Healthy Mother, Healthy Baby project on MNCH field, and LHSS Tajikistan. Next slide, please. So partnering with Ministry of Health of Tajikistan, both of our projects studied digitalization of health, because that is quite new for Tajikistan, and COVID-19 pandemic showed that there is a need of systematic approach for clinical guidelines, protocol standards, all up-to-date evidence-based materials for healthcare workers, which were just not existing in Tajikistan for very broad access for the healthcare workers. So based on this need, we created a platform, a knowledge hub, where we collected all clinical guidelines, standards, protocols that are necessary for healthcare workers in their day-to-day work. And especially, we started this for COVID-19, all documents, because that was the first need for that time in Tajikistan. Next slide, please. So we started promoting Knowledge Hub through meetings with Ministry of Health, with Republican Center for Immunization, with Family Medicine Accreditation School, with Medical College, with the Medical University, to expand and promote usage of Knowledge Hub as the best hub to get all documents that is necessary for the healthcare workers. We started to digitalize all clinical guidelines and WHO-approved protocols in Tajikistan, so they can be in very easy access from any part of Tajikistan, as there is a need, and printed materials cannot be delivered in time. We also, as you can see from the photo, we in 12 of our pilot districts, we implemented the 24 nutrition resource centers. And through these resource centers, we are doing education sessions. At all sessions, we are showing healthcare workers how to access Knowledge Hub, what documents they can find there, and how they can use it in their day-to-day work. Next slide, please. So here you can see just a screenshot of the users. Approximately in Tajikistan, unfortunately, no one knows the exact number of healthcare workers because of migration. So about 24,000 of healthcare workers. This includes doctors and medical nurses. So as you can see, almost 50% visited already Knowledge Hub and used the materials that are inside of Knowledge Hub. Next slide, please. So here, as you can see, last month, we added Health Security Net link into the Knowledge Hub and also introduced it during our all educational sessions that we have for healthcare workers, and actually training them how to use it. It's very friendly. That is the feedback from the healthcare workers from rural areas that we have, because you can really search by the words that you need. You just put a word, you just put a field, and you find materials what you are looking for. For example, for COVID-19, some of our healthcare workers, they really liked it because unfortunately, we didn't have anything in Tajikistan, something that is, easy, approachable. So would like to thank my colleagues from Georgetown University. And this is feedback from rural healthcare workers that we got during our introductory sessions. Next slide, please. And I think that is mainly all about our implementation in Tajikistan, and I'm passing over to James, please.
Great, thank you so much, Gulnora. And that's just one country example of how we're, as a project, trying to mobilize Health Security Net, not just as a tool itself, but also linking and integrating with the existing health knowledge hubs or other modes of communicating with health workers in a country. So again, thank you to everyone for presenting today. We don't have a lot of questions. I hope that means, and I'm assuming that means everyone's just anxious to go download some documents. We did have one question about the best way to share materials. So if we have national level tools or other materials that people know exist, how can they share those? So maybe Dr. Katz or Haley, I guess the main email is the best way, but yeah, so over to you.
Just to reiterate, I mean, absolutely. We are always excited and anxious to include more material. And it gives us the opportunity to review it ourselves and code it into all the places that'll make it easily findable for other users. So yes, please do send us the material. The email, the link is now back up in the chat, and the email address is healthsecuritynet@georgetown.edu. And just
there we go.
It magically appeared in the chat. Thank you.
That's great. Yes, absolutely. So of course, that will be a living tool. I'm sure we'll be using some of those tools in our work starting tomorrow, and of course, integrating those as more become available. If there are no
But James,
other
I would just quick note, it is so exciting for us to hear about how the tool is being used in different contexts. We also assume that, as I mentioned before, every time somebody uses it, it's going to be different in different contexts. And so if you are using it, if you have a suggestion, if there is something that will make it easier for your community, please do let us know. We are always eager to get that kind of feedback.
Yeah, absolutely. Thank you so much. I think we see a lot of implementers on the line, and hopefully if you have any questions or concerns about how to operationalize these tools, reach out to any of us. Absolutely. So seeing that there are no questions, there's no need to continue this too long. I think there are a few housekeeping items. We'll mention again the healthsecuritynet.org URL. We've shared the email. Once we close the webinar today, you will receive a request to tell us how it was, if there was any information you would have liked to have heard. Please provide your feedback and suggestions on ways we can improve launch of these sorts of resources in the future. In a few days, you'll also receive a link to the full recording with a transcription for closed captioning that will remind you of all these URLs as well. And then additional links we're going to be sharing with you right now. And this is the sort of hit the like button, Twitter, Facebook, YouTube, all of that stuff. So you'll see those coming into the link. And that's more about LHSS, and that's more about this project as well. If you're interested in any other upcoming events, please visit the LHSS project website and let us know how we can help with these tools or others. Thank you so much to our colleagues from Georgetown. It was an absolute pleasure working with you on this project, but I think all of us will continue to benefit from the ghsidea.org suite of tools, as well as Health Security Net. So thank you all. Bye.